Okay, the stream is live. So good evening. This is March the 14th. This is a late night work session of the Government Operations and Health Facilities Subcommittee of Health and Government Operations. Tonight, we're going to take up four bills in the following order. First, we will have House Bill 1473, followed by 1499, followed by 333, and then we will go to House Bill 957. By that time, we hoping to get some definitive responses in for that one. All right, let's get started. We have with us tonight Committee Counsel Lindsay Rowe, who is responsible for these bills, and she will walk us through them. And we'll start with House Bill 1473. Lindsay.
So this one we started discussing earlier. The bill expands existing requirements for specified state departments, agencies, and programs regarding efforts to provide equal access to public services for individuals with limited English proficiency. The amendments from the sponsor strike the mandated $400,000 appropriation to the Governor's Office of Immigrant Affairs and restores the existing percentage under current law of 3% for the limited English proficient population for which vital documents must be translated.
Do I have a motion on the amendments?
Move the amendments.
And a second?
Second.
Thank you. A motion and a second on the amendments. Discussion on the amendments. Delegate Johnson.
Thank you, Mr. Chairman. I'm still a little confused about this fiscal note because I see the amendment strikes out 19 through 21 on page 3, which that required the governor to put in $400,000. However, we're expanding the services. So how is it that it has no fiscal note, or is the fiscal note that I have here in front of me that says $200,700 in 26 and then goes up from there? Is that after we remove the 400,000?
The fiscal note was written to the first reader version of the bill, so it doesn't reflect the sponsor's amendments. So the amendments do two things. They're removing that $400,000 mandated appropriation, and then they're also, the bill was originally reducing from 3% to 0.5% the percentage of the population that spoke a given language. And so that was significantly well, we don't know how much, but expanding the number of languages covered, right? Because it was a smaller population captured, so it'd be more languages covered. So it's restoring that back to 3%, which is what's current law.
So it's what we're spending now?
The agencies that we heard from earlier said that this would be just sort of clarifying and the activities that these agencies would have to be doing, not necessarily causing them to spend more money, but just clarifying sort of how they spent that money.
Oh, how they spent their existing money. Okay, so there'll be no more, so that we can cover it all under existing funding.
I think that's correct, Delegate Johnson.
All right, thank you.
More discussion on the amendments? I'll call for a vote on the amendments. All in favor of adopting the amendments, say aye.
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 Opposition to the amendments? Seeing none, the amendments are adopted. Do I have a motion on the
Move the bill.
amended?
Second.
We have a motion and a second on the amended bill. Any discussion? Seeing none, I'll call for a vote. All in favor of the bill as amended, say aye.
Aye.
Opposition to the amended bill. We have Delegate Chisholm. Okay, thank you. I think I have the vote right. Thank you. I see Delegate Acevero joined us. And thank you for joining us. We have completed the work on House Bill 1473. Moving on to House Bill 1499, it's Delegate Johnson. And let's hear about it. Lindsay?
This bill requires that state procurement contracts for construction and contracts for services include as introduced. The bill required that state procurement contracts for construction and contracts for services include a clause that requires contract modification for the equitable adjustment of a contract for increased costs for compensation and benefits as a result of statutory changes increasing required compensation or benefits or collective bargaining. The amendments submitted by the sponsor, and I've made a slight adjustment to them in response to Delegate Johnson's feedback earlier, make the required clause for construction contracts applicable to a contract that is for 3 years or more, rather than more than 3 years in duration and valued at greater than $1 million, and limits the required clause for services contracts to contracts that are for security services only, that are again for 3 years or more in duration and valued at greater than $1 million, and specifies that a contract modified under the bill is contingent on approval by BPW.
Delegate Johnson, there were some questions about,
Yes, Mr. Chairman, let me just for clarity, Delegate Hill asked a question yesterday about, does the state have the same opportunity if something happens to go back and lower? Well, we do have those provisions. Just for an example, if they were building the Key Bridge and the bid was with toll booths, and then they decided they were going to put scanners and tag readers in, then if it was a lesser amount to take the toll booths out and do it the other way, that would automatically be deducted from the contract. So we already have things in provision to do that if it benefits the state that way.
Move the amendments.
a motion on the amendment. Do I hear a second?
Second.
All right, I have a motion and a second on the amendment. Any further discussion? Delegate Hill.
Thank you. Delegate Johnson, thank you for that explanation. Now, this had, fiscal note said potentially significant increase in procurement costs. Because that's vague and it's not in this budget, is that not, we're not looking at that, right? That's exactly what the bill does. So it's not really an issue in terms of a fiscal note. Is that correct?
That is correct, and we moved the date out to 2026, October 2026.
Thank you.
Okay, I have a motion and a second on the amendments. Any further discussion on the amendments? Seeing none, I'll call for a vote. All in favor of adopting the amendments, say aye.
Aye.
Opposition to the amendments. Seeing none, we'll consider those amendments adopted. On the bill as amended,
Move the bill as amended.
Second.
I have a motion and a second on the bill as amended. Is there any discussion on the bill as amended? Seeing none, I'll call for a vote. All in favor of House Bill 1499 as amended, please say aye.
Aye.
Any opposition to House Bill 1499 as amended? Delegate Kipke, Delegate Shalega. Okay, do I have the vote right? Okay, thank you.
Thank you, Mr. Chairman.
House Bill 333. Lindsay.
As introduced, this bill established new responsibilities relating to the cybersecurity of the healthcare ecosystems, including staffing, reporting, auditing, and the establishment of a work group for healthcare ecosystem entities. The amendments submitted by the sponsor strike most of the bill, and rather than requiring MDEM to convene a stakeholder work group, establishes a healthcare ecosystem stakeholder cybersecurity work group staffed by MHCC and MIA, tasked with developing strategies to prevent cybersecurity disruptions to the healthcare ecosystem services, ensuring the continuous delivery of essential healthcare ecosystem services, and enhancing recovery efforts of the healthcare ecosystem following a cybersecurity incident. The work group must submit an interim report on or before January 1st, 2026, and a final report on or before December 1st, 2026.
Thank you. Do I have a motion on the amendments?
Move the
Move the
amendments.
amendments.
Okay, we have a
Second.
motion to second on the amendments. Discussion on the amendments. Delegate Kipke.
Thank you, Mr. Chairman. Actually, I see Jake Whitaker has his hand up, so I'll refrain we can let him talk, I guess.
Okay, thank you. Jake Whitaker.
Great, thank you, Mr. Chair and Delegate Kipke.
So we're opposed to this legislation for a couple of reasons, including the new amendments for the work group. I think the first reason is MHA convened a work group over the interim with some of the same stakeholders that are already included in the work group as proposed, including the MIA and MHCC. Additionally, I think most importantly, there's already a state council that's designed to handle this kind of stuff, the Maryland State Cybersecurity Council. And I think specifically there's a subcommittee, the Critical Infrastructure Subcommittee, which includes hospital representatives and other folks in the healthcare ecosystem, specifically designed to address this issue. So we do think it's redundant, especially in light of the current fiscal realities. And I think most importantly, the current Cybersecurity Council at the state level is a permanent kind of structure. And because these standards evolve so quickly, if we only have a temporary kind of subgroup or work group that's proposed by this bill, they could propose some standards, then they get outdated because of the new technology. So we think the permanent framework at the State Cybersecurity Council is more appropriate to handle this issue. So for that reason, we're respectfully opposed to the amendments. Thank you.
Okay, thank you. Delegate Kipke, do you have a response, or is that what you were looking for?
Yes, thank you.
Okay. Delegate Hill.
Yes, Delegate Chair Kerr, can you respond to why the current cybersecurity commission or the under cabinet, whatever, what Jake was just referring to, why that's not sufficient? I know that your cross-filer is very familiar with that, but why is that not sufficient?
Well, we have seen recent cybersecurity attacks, a ransomware attack at my own hospital. So I guess the thinking was over the summer, when we had been discussing this, that we have not seen a set of recommendations or suggested actions from the current groups that currently exist, as Mr. Whitaker explained. So the thought was that we need a group to specifically look at the healthcare ecosystem, so that if these reports exist, they would surface. If they don't exist, we would see what needs remain, and the work group could then investigate those and make recommendations.
Thank you.
Delegate Guzzoni.
Thank you. Is there a cross-file on this? And if so, who is it?
It's Senator Hester has a cross-file. It's not listed as a cross-file because the bills were not submitted in exactly the same posture, but with these amendments, the bills do conform.
Thank you, because I checked and didn't see that. So I appreciate that.
Any further discussion on the amendments? Call for a vote on the amendments. All in favor of adopting the amendments, say aye. Opposed to the amendments? Okay. Delegate Chisholm, Delegate Shalega.
Are we on 333?
Yes.
And I'm sorry, have we heard from the hospital? I'm sorry, I was late. I
Yeah,
went
we
to
did.
committee
We heard
thinking
from-
we were. Okay,
We heard from the hospital prior to the adoption of the amendments. The amendments were just adopted. So now with the adoption of the amendments, I'll call for a motion on the adopted bill.
Move the bill as amended.
Second.
Okay, we have a motion and a second. Discussion on the bill as amended. Delegate Kipke, same situation?
Our mute button. I was just going to say, Jake looks like he has something else he wants to say. So I don't know if we wanted to ask him. All right. Hey, Mr. Chairman, can I ask Jake Whitaker what he'd like to say?
Yeah, please do
Thank
that.
you.
All right. Jake Whitaker.
Thank you, Delegate Kipke and Mr. Chair. Respectfully, if the committee does decide to move forward with the amendments, we do have some concerns about the composition. Specifically, it's supposed to regulate hospitals, but the Maryland Hospital Association is not included, whereas the League of Life and Health Insurers on behalf of the insurers are included. So if anything, we would just respectfully request to hold it, at least briefly, if the committee is going to decide to move it forward, so that we could submit some amendments. I know we're up against the deadline, but we'd happy to be turning around something very quickly.
Yeah, if you just want the Maryland Hospital Association included, we can take care of that right now.
We also have some additional concerns. There's 3 patient advocacy groups as well. It's kind of a technical work group, so of course, we want to hear from patients, but in this respect, it may not be the appropriate work group, given that it's a technical kind of group. So we did have concerns. We do have some other additional concerns, but those are the main ones. And that's why respectfully, we would request the appropriate time to be able to amend it accordingly.
Okay, let's see what the rest of the committee has to say. Delegate Hill?
Thank you. Mr. Whitaker said that that this is going to regulate the hospitals. I'm reading the work group is making recommendations. I don't know if that's a correct interpretation. I wanted to get that clarified.
It's probably a misstatement that if the recommendations are adopted, I think that's what you meant, Jake?
That's correct. Thank you for clarifying, Delegate Hill.
Because that would have to come through another bill. So
Right.
that would be.
That's right. The bill just specifies that the work group would make recommendations on potential regulations in this space. But you're correct, Delegate Hill. Thank you.
Okay, thank you both. Delegate Johnson?
Thank you, Mr. Chair. So Jake, we're trying to move things along. So you had an issue with the other folks in the work group. Is that the only thing you have an issue with?
We're still reviewing it with our members. Like I said, those are some of the feedback that I've received thus far. We'd be happy to turn around some amendments as quickly as possible. I know crossovers on Monday, but that's kind of where we're at right now, where we at least have concerns about the membership composition. But again, I haven't fully gotten feedback on every single line item since we received the amendments yesterday afternoon.
Since this is just a recommendation work group?
Yeah, and then I think ultimately we feel it's duplicative. There's a state infrastructure in place to do this. So I think ultimately, as I mentioned before, I think we're ultimately opposed to the work group. But again, we would just respectfully request just a few hours to be able to pull together some amendments if possible, or till the next subcommittee meeting.
Can you tell me what the status of the work that these other groups have done is, and is there anything that's been published?
I know they generally submit reports. I haven't looked at everything they've pursued, but perhaps this might be the impetus to kind of ask them to kind of pursue the specific issue.
Matt Celentano?
Thanks, Mr. Chair. I would be one of those folks that's named in the work group as the executive director of the League of Life and Health Insurers, and I think this is a conversation that is definitely worth having. We see breaches in all aspects of the healthcare landscape more and more. There's no way we can escape some of these security concerns and hackers that are nefarious and looking for all kinds of ways into the healthcare landscape. The carriers already operate under incredible amount of cybersecurity laws and regulations, including a massive data breach bill that all of the General Assembly passed a couple of years ago. There is one entity that has pretty much all the information from all the stakeholders that are mentioned in this work group, and that's the hospitals, because they have the doctors, they have the pharmaceutical manufacturers, they have pharmacies, they have carriers. All the information is going through the hospitals. The hospitals are one of the entities that have no real cybersecurity policy. So it is certainly appropriate to have everybody coming to the table to make sure that we have consumer protections, we have backstop, and it is a definitely appropriate work group for us to discuss what the next steps are for the Maryland General Assembly as we modify with the evolving universe of technology and making sure that consumers are made whole. So that's my 2 cents. Thank you very much.
Okay, thank you. Jake, I'll come back to you after I hear from committee members. Delegate Hill?
Thank you, Mr. Chair. I'm again reading the membership. I thought Jake was saying that the hospital association didn't have representation, but I'm reading in the new language, a representative of a freestanding medical facility, a representative of a large hospital, a representative of a small hospital, a representative of an inpatient psychiatric hospital. So I just, are you saying that in addition to those, you think the hospital association needs to have a separate spot on this group, this commission?
Yeah, I think respectfully, since the other trade associations for the other members of the healthcare ecosystem as prescribed in this bill are included, I think it would only make sense to include us. I know it does have multiple members of hospitals on the work group, but I think to adequately represent the hospital field, it would be helpful to have MHA on as well.
And so the trade associations that are represented, are they also represented individually or just one representative from the trade association?
I believe it's the trade association representation.
Right. So you're saying that you think the hospital association representation, in addition to the individual based on size, is important, and that the individuals at the hospital association, I assume, would be nominating the hospitals to play in those roles, that they can't represent well enough without the association itself being there?
Yeah, and like for example, I think there's a lot more hospitals in Maryland than individual health insurers or carriers. So I think it's kind of apples and oranges, and that's why we would like MHA to be represented.
Delegate Johnson?
Thank you, Mr. Chair. I didn't get to complete my question the first time around. So since you think that it's duplicative and you don't agree with some of the folks that are on the workforce, Jake, is there any amendments that is going to move the hospital association to a favorable?
I'd have to take it back to our members. They're reviewing it actively. As I mentioned, we received the amendments yesterday. I do know that they requested that we are represented on there as well. But like I said, I'd have to get more feedback, and we're actively engaged in that right now.
All right, thank you. Thank you, Mr. Chairman.
Thank you, Delegate.
Delegate Alston?
To Jake's one point about the hospital administration, I would recommend the CEO of the Maryland Hospital Administration or designee as their member. And so I would suggest that as a conceptual amendment. We're trying to help you out, Jake, but we need more information. But I think based on at least what I've heard, I am comfortable moving that.
Does anyone want to second Delegate Alston's amendment?
I'll second it.
Okay. Lindsay, do you have that?
So right now, the wording is one representative from each of the following organizations designated by the head of the organization. And I think under that list, we would add a representative from MHA,
Okay.
the Maryland Hospital Association.
Okay, and we already voted on the first bunch of amendments, so this would be a second amendment.
So it would just be, this is in the amendments, so I can't really reference a page number, but it's, wherein the work group consists of the following members in C under 8, C8, one representative from each of the following organizations designated by the head of the organization, and we would add MHA there.
Okay, thank you. We have a motion and a second on the new amendment. Delegate Johnson?
Thank you. If you know, Lindsay, so how many people are on this work group, and how many people does that make now for representing hospitals or the hospital association?
I have not counted the number. But as Delegate Hill mentioned earlier, there's a representative of a large hospital, a representative of a small hospital, and a representative of an inpatient psychiatric hospital. I think
I
those
just didn't want to see us stack the deck with hospital representation.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14,
I
15.
think with the amendment, it would be 26.
Oh, I counted 23. Perhaps I've miscounted. And
I think you're right. I think I counted the language about who was providing staff and who was co-chairing. So I think
Okay,
you're
so
right.
23. Anything else, Delegate Johnson?
No, I think that's enough where it's not going to be a stacked deck. So
Okay.
thank you.
Thank you. Delegate De Veras?
Well, I am good with going with the majority of the body and what they decide, but just want to flag that is like the hospital having essentially 4 votes in a body of 23. And I don't know how people feel about that. Because at least the other 3 would come in from their own unique perspective, but they would be representing hospital interests. um, compared to other stakeholders, which would only bring one vote to the table, but I mean, but I would go again with the majority of the body.
Okay, thank you. Delegate Hill?
I was just going to say, I'm not uncomfortable with that because again, this is about the cyber attacks, and a lot of them have been to hospital systems. So I don't think that for me, it's not a problem, but I really would like it, Mr. Chair. Maybe, I mean, you obviously it's your decision about how we want to keep this bill, but I would really appreciate if Jake could give us some other idea. We're taking the time to amend the bill. I'd like to amend it now, but that's just me.
Okay, well, we have a motion and a second on the amendment. Let's hear from Delegate Kaiser.
Thank you, Mr. Chair. It's your bill. I was curious, what do you think of this amendment?
I'm fine with having Maryland Hospital Association be represented. I mean, the hospitals are the main focus of this cybersecurity audit and the recommendations that we're going to make. So I don't think that that having 4 out of a 23 member is disproportionately weighed in the hospitals to the hospital's favor, and if it's going to mostly affect them. Delegate Hill?
I just wanted to ask Jake, generally, what are the other areas that you think you'll be looking at amendments to? So we have a ballpark idea of what it is you're talking about.
Thank you, Delegate Hill. Certainly part of the composition. So as I mentioned before, the patient advocates may not be the appropriate stakeholders. Of course, we'd love to hear patient feedback, but in this specific instance where it's such a technical nature, they may not be the appropriate stakeholders to be at the table for this issue. Some of the recommendations related to state level regulations are problematic. I know Mr. Celentano mentioned that we don't have a lot of regulations, but we have numerous regulations at the federal level, as well as accreditation standards that we need to adhere to in order to be compliant. Additionally, in order to maintain our cybersecurity policies and obtain them, we also need to meet these standards, have the assessments, as well as the audits that are outlined in the original version of the bill. So I think those are some of the things that we'd like to take a look at. And again, I know we're at a super short timeline right now, but we just received the amendments yesterday, and I have more than 60 different members that I need to get feedback from. So we're working on that right now.
Further discussion on the Second Amendment? All those in favor of adopting the Second Amendment, say aye.
Aye.
Opposition to the Second Amendment? Don't see any. Okay, then we'll have to remove the bill again as it's been re-amended. So on the bill as amended, is there a motion?
Unless we're holding it for these additional amendments. You said we have to remove the bill, but he's asked you to hold the bill for more amendments. So it's your bill, Mr. And you're the chairman.
I will entertain a motion to on
Move
the
favorable on the bill as amended.
Okay, Delegate
Second.
Johnson.
Yeah, Mr. Chair, I wanted to see how many members that took out, taking the advocacy groups out, because the more we take out, then again, the more we stack the hospital's voice on this. So I just wanted to make sure that if that's what we're going to do, I would not be in favor of holding the bill. If it's for a different amendment, then okay.
Yeah, Delegate Casoni.
Thank you, Mr. Chair. On the 3, because it doesn't really seem to say for these 3 patient advocacy groups, what would the expectations around them be? Like, this is a cybersecurity focused bill. So, and it doesn't say anything like we'd want them to have a level of knowledge of cybersecurity or they've been impacted negatively. I just curious, like, how
Well,
would these folks
groups
be
like
good?
this, typically it's the patient perspective, that it's the patient's records that are breached, it's the patient denial of service that happens, it's the patients that are inconvenienced. Okay, any other discussion?
Delegate Kaiser moved the bill as amended and I seconded it.
Okay. Now look, there's we really have to move.
That
forward.
was not there was no amendment offered to remove anyone as far as I recall.
Okay,
The amendment is just to add an MHA representative. No other people added, no one removed.
okay. I'm gonna go ahead and call for a vote. All those in favor of the bill as amended, say aye.
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 Hold
Anyone
up, what amendment did we put on?
To include the Maryland Hospital Association.
And that was the amendment we had?
We had a series of amendments that turned the bill into a study and listed membership in the study. We adopted that amendment. Then we adopted the amendment suggested by Jake Whitaker and put forth by Delegate Hill to include the Maryland Hospital Association.
Okay, so it's just a study now.
It's a study now, yes.
Thank you.
Okay, Delegate Chisholm,
Just for the good of the order of the study, remove the physical note, correct?
correct.
Thank you, sir.
All in favor, say aye.
Aye.
All opposed? Okay, thank you. Moving on, one more bill. If we can handle it quickly, we can get to it. 1499,
We did that. The last one is 957.
957, thank you.
This bill was discussed somewhat earlier. The bill establishes state residency requirements for apprentices, journey workers, and employees on state contracts. There was discussion about the sponsors' amendments, and there were some questions left over from the last meeting about maybe trying to limit the application in some way.
Okay, Sharon, any luck hearing back from your advocate?
Yes, thank you, Mr. Chair.
Stakeholders?
Yes, sir. So there are more amendments forthcoming, but in terms of the amendments that are already submitted, they're going to be addressing the MDOT's issues in terms of constraining the contractor pool. We're going to be amending the employee requirement to be a apprenticeship requirement and changing it, of course, from 51% with the employee requirement to 35%.
Let me interrupt you just a second.
Yes,
Are
sir.
you not ready to move ahead with this right now?
Are we ready to move ahead with it?
Yeah.
As written?
Do you have all of the answers you need to take action on this bill this evening?
I would not say that.
Okay, then we'll just hold the bill with the understanding that we may not get back to it. Okay, with that, there's another subcommittee waiting for us to end so they can start. So with that, we are adjourned. Thank you.
Yes, sir.